Health IT budgets at the federal level, I see a lot of money, and probably not new money being spent, but a redistribution of resources being spent on data analysis and aggregation. Coming up with ways in which once the data starts coming in, we can use that data for decision making to influence policy decisions and spend on national healthcare related issues. Healthcare dollars that are spent at the provider level, I envision that the majority of the spend will be on actually adopting technology that works, putting into practice workflow changes, as well as technology platforms that are consistent with the organization's business needs. And then at the community level, I think a lot of money should be spent in engagement and outreach and education so that we can continue to move the market to do the right thing, which is enable the sharing of data so that we can improve healthcare quality, access, and outcomes. Well, immediately, the steps that we're taking to meet the longer-term goals of the healthcare requirements, specifically around meaningful use and helping providers get there, is creating a successful organizational structure. So I started in the position of President and CEO on July 1st, really with a temp and 3 wonderful interns and some shared services through one of our board members. So standing up an organization that can be viable has been our first priority. The second priority is creating a foundation or a floor that meets the needs of providers in California. So in essence, you can think of eConnect as maybe a public utility service. And so in order for providers to achieve meaningful use, not just in stage 1, but in stage 2 and 3, they have to be able to share structured health information, and then others have to be able to use that structured health information to make decisions. Change how they're treating patients, change how they're delivering service, increase access to care. And so eConnect is working on creating a floor or a foundation for that exchange that allows providers to know who they can share data with, what the protocols and the standards are for exchanging data with those individuals so that the systems can populate in a way that it reduces the workflow or the extra effort that's typically associated with a paper transaction. And so our immediate steps is setting that floor and creating the foundation for exchange by giving providers in California, in essence, the rule book, or maybe some use the phone book analogy around who they can send data to and what format it needs to be in, and in order for those providers to receive it in a way that achieves the meaningful use rule. In February of 2009, when President Obama signed the American Recovery and Reinvestment Act and created what we now know as HITECH, there were different allocations of monies that states were eligible to receive. California has been incredibly fortunate in that we've received money in each one of the buckets. The first bucket, which I think is paramount to our success, is money going to regional extension centers. Those regional extension centers, in essence, are like the geek squads for EMR. Their job is to get the EMR into the physician's practice, help them decide what product to buy, help them change their workflow so that the product they buy actually meets their business needs. The second bucket of money is the funding that we've received, eConnect, and that is for a state health information exchange. Each of the states has been given opportunity to enable health information exchange by creating a governance structure, creating a technology platform, and then policies. And so that funding came to the state of California and has been granted to our organization to enable exchange. So once the providers have the EMR, the next step is now exchanging the data in the meaningful way that we often hear about through these efforts. The third bucket of money, which is equally important but often doesn't get acknowledged, is in the telehealth in the broadband area. There were clauses, or are clauses, in stimulus or the American Recovery and Reinvestment Act around increasing broadband, particularly in rural and underserved communities. And so the goal is for those communities to have access to telemedicine and to have a secure robust network or framework for sharing what are really large electronic transactions. And so that's a considerable piece of the pie, because at the end of the day, the public good comes out of the public value, and increasing broadband in communities that don't have it will help them achieve their healthcare goals. And then the fourth bucket of money goes to communities that have been designated as beacon communities, stellar communities that are taking all of those other three resources, putting them together, and actually exemplifying how electronic medical records, health information exchange improves healthcare quality, efficiency, and access. And so California has one beacon community in San Diego that I've been able to communicate with and work with, that's working on creating, in essence, a demonstration of how health information exchange and EMR adoption has improved healthcare quality in their community.